Health is a state of being free from any form or sort of illness or ailments, be it physical or spiritual or any injuries. Your program today is Health Check, and your host today is Nambale Bashir, a program where we bring medical experts to help us understand different diseases, how they affect us, who are at the risk of contracting certain diseases. With me today is Dr. Herbert from Mbale, an eye specialist. You're welcome, doctor.
Thank you so much, sir.
Did you know that even the eyes, at a certain point, can contract or have ulcers? And what are the ulcers of the eye? That is what we need to discuss today, and the topic is corneal ulcers, the ulcers that affect the eye.
Yes.
Doctor.
Yes, sir.
What are the corneal ulcers before we go any further?
Thank you so much. Yes, our topic today, corneal ulcers, very, very, very important topic to know and to discuss and to let our viewers know. It's one of those emergencies that we encounter in eyes that can actually lead to blindness.
Okay.
So it's very, very, very important to know. So corneal ulcers, the cornea is I'll describe it like a glass of a watch. If you have a watch, you can look at the glass of a watch. So that's how clear and that's how clear a cornea looks like as well. It's just like a glass of your watch, clear and transparent. Yes. So that glass of your watch, which
so clear that you cannot miss a detail beneath that glass.
That's right. That's how a cornea is. Very clear. So what happens that its top surface or its uppermost or outermost surface can get breaks or tears, which we are calling ulcers.
Okay.
So those breaks and
briefly,
tears.
ulcers are wounds.
Yes, they are wounds on the cornea. So corneal wounds or corneal ulcers is what we are describing today.
Okay.
And it's very, very important to know. Why? Because one, it can cause bad complications, and one of those complications is blindness.
Oh.
Yes.
So that's how risky it is.
That's right.
Before we go any further, we need to go deeper and explain to our masses why does this ailment affect the people to the extent they go down in depression due to the fact that they've contracted this disease, the corneal ulcers.
Yes.
Yes.
Yes. Very interesting findings there. Yeah. So it's one of those very common diseases that we handle every day in our clinics, our eye clinics and our outpatients. Very, very common. Actually, out of maybe 70 patients that you'll see, you'll at least find 5 to 10 corneal ulcers a day here in our setting. So very common condition and can cause really, really bad complications. And one of those is blindness, which can actually cause depression. That's right. When a person goes blind, they're not the same again.
Yes.
So they need to be rehabilitated, they need to be counseled, they need to be talked to, they need to be trained, they need to go through a process of rehabilitation such that they can know, though I'm blind, I can still go through this life successfully.
Okay.
Yes.
Okay.
Yeah, so it's very important that this condition is managed very promptly such that we prevent blindness.
Okay.
Yeah.
Thank you so much, Dr. Herbert. As far as ulcers are concerned, I thought this is only something that we can find in our bellies or stomachs.
Okay.
But to my surprise, today I found out that even the eye can have ulcers. How is this corneal ulcers different from any other ulcers?
Yes. Now, this one is quite different. Most of the other ulcers affect mucous membranes and also the skin and other parts of the body. Yeah, but this one is quite different. That's affecting a very special part of the eye called the cornea. And the cornea is a very important part in vision. Yeah, it's one of those parts of the eye that allow us to be able to see. So anything that interrupts or affects the cornea will also interrupt your vision. Okay. Yeah, so that's why some of the symptoms that we are going to learn probably in the next few minutes, we shall realize that the person will come with poor vision or will complain that I'm no longer seeing well, because of the cornea being affected by an ulcer. Okay. So it's a quite different ulcer from other ulcers, and this one is specifically on the cornea and so on the eye.
So this is on the eye specifically.
Yes.
Unlike some other ulcers that affect different parts of the body.
Yeah.
What causes it?
Yes, so the causes of corneal ulcers are quite a number, but I will talk about the most common ones. One could be trauma. You can be traumatized by anything, maybe an accident while you are playing a game, children playing together, one can poke the other with a stick and rubs over the cornea and causes an ulcer.
Okay.
Yeah, so that is trauma cases. Others can be chemical injuries. We have some people, because of their occupation, they interact with chemicals every day.
Okay.
Like those that are working in factories and industries. Others are farmers spraying their crops with chemicals. So in one or the other, a chemical could drop on your eye. And we know some of these chemicals are very corrosive, very toxic. So the moment it drops on the eye and touches the cornea, it corrodes or burns the cornea and leaves an ulcer. So that is some of the causes. To go further, infections, which is actually the most feared cause, actually, because others can easily be handled, apart from this other cause. So infections can cause
infections catch you unaware.
Yes. So these infections can be by bacteria, can be by viruses, can be by fungi, can be by protozoa. All those microorganisms can cause these corneal ulcers. And then they will present differently. What is caused by a bacteria will be different by what is caused by a virus, be different by what is caused by a fungi, but they're all corneal ulcers. So that is how complicated it can be. Yeah, so because of that, these organisms can also penetrate through, you know, the cornea is like a wall covering the inside parts of the eye. So if you break into the wall and the wall has a break, that means these organisms which are dangerous can now enter inside the eye. Now, if they enter inside the eye, that means they're going to affect also the other healthy parts of the eye, and you can end up losing that eye. That's why I say that the ones that are caused by infections are even the most feared.
The most feared and
yes,
dangerous.
And they have to be handled very aggressively. Yeah, so other causes can be other diseases, like if you are diabetic and your immunity is quite compromised, you are HIV positive and your immunity is quite compromised, you can get ulcers on the cornea. You have dry eye syndrome, which we discussed some time back. Yeah, you could realize that the dry eye, because you're not lubricating the cornea very well, it will become rough and then cause ulcers.
Yes. True.
So it is important that this condition is handled aggressively because of the complications that it can come out with. Yeah.
Doctor,
yes.
Having understood the causes of this complication, then we need to know who is at a higher risk of contracting corneal
ulcers.
Ulcers, yes.
Okay, that's a very important question. Yeah. So just after we have discussed the causes, we now know that some of these people are at a risk factor. Those ones with diseases that suppress their immunity, like the diabetics, and those that are HIV positive, those other patients with cancers that have compromised their immunity. It can give chance to these organisms that we are talking about to penetrate the cornea and cause ulcers. Yeah, so risk factor, those people with other conditions that compromise their immunity can lead to this problem. Number two, the occupation of some people. Because of the nature of their work, they are predisposed to these ulcers. Like people who are working in the fields, the farmers, others are on roads, construction, engineering work. Welding, yes. Others are on buildings, they are masons. So these people are at a risk of getting ulcers due to trauma.
There are some people here that ride motorcycle riders.
Yes, like here in Uganda, motorcycle riders, always on the road. Others don't have protective gears. So
and in the West, they call them, Western Africa, they call them Okada men.
Okay, yeah. Yes. Yes. So some people are riding them without protective gears. So definitely, as you ride along in a dusty road, you can traumatize your cornea and get ulcers. Yes. So those are some of the risk factors. Others, we can discuss later.
Okay. Thank you so much. And now this brings me to the signs and symptoms. How can one know that they, at a certain point, have contracted corneal ulcers?
Okay, thank you very much for that question. So signs and symptoms. One, the patient will present with pain. They will come with pain.
Severe pain.
Severe pain, that's right.
Okay.
The pain is not ordinary, actually, for most of the ulcers. The patient comes in severe pain. Because the cornea is one of those very sensitive parts of the body. Have you ever tried to touch it?
Why should I bother it?
It's very, very sensitive.
Yes.
So no one wants anything to touch the cornea. Because
you know,
it is
the
very,
only
very
time that I realize how sensitive it is when maybe an insect accidentally drops or falls on the eye.
You cannot sleep through
that
night.
You can't sleep. You can't even rest for a minute until it is removed.
That's right. Yeah, so that is how sensitive the cornea is.
Yes.
So the person will come with a lot of pain. That is one. Two, fear of light. They'll be fearing light. They don't want to go to any place with light.
Oh.
Like our studio here, which has very beautiful light. A person with corneal ulcer cannot bear it.
Okay.
Cannot bear the light. Yes. Tearing. A lot of watering from the eyes. Tears rolling down because of the irritation that is on the surface of the eyes.
One might think you're crying, yet you're having a corneal ulcer somewhere in your cornea.
That's right. And then redness. The eye can actually be very red. Very red.
Okay.
Sometimes they will have some discharge coming out of the eyes, the pus discharge.
The pus, okay.
Yes. Especially for those causes that are infectious. Yes. And the person can also have headache. Yeah, and the general discomfort. Yeah.
Talk about blurry vision.
Yes, blurry vision, yes. The patient, definitely, like we explained earlier, that the cornea is one of those important parts that enable us to see clearly. So if you have something covering it or offending the cornea, definitely the vision will reduce significantly, by the way. Significant reduction in vision. Today you are seeing clearly. When you get an ulcer, you barely see anything clearly.
Okay.
Yeah. So significant reduction in vision.
Okay.
And the later complication that could happen if the condition is not treated early is that sometimes it can heal on its own, but leave a very big scar on top. A scar on the cornea appears white. So you cannot see through it. It has made the surface opaque.
Yes,
supposed to be clear and transparent, like we explained earlier, like a glass of a watch. Very clear and transparent. So now it is covered by a white thing. So it's like you're seeing through a white curtain.
Yes, yes.
You see very cloudy things. Yeah. So one of the complications would be that very poor vision. Other times it could even lead to blindness.
Okay. Doctor, another question.
Yes.
This would go to our viewer. You know, this program is aimed at enhancing our viewers with more information regarding certain ailments.
Sensitizing.
And to this effect, would like to know their view regarding this topic of discussion today.
Yes.
I have one of my colleagues moving around the streets of Kampala, collecting information from our viewers regarding this ailment or type of ulcers which affects the cornea. And we need to know what their view is regarding corneal ulcers. Let's have a look at them.
Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Taufik Wasoma from Kampala. And I'm here for the concern of the corneal ulcers. According to my opinion, corneal ulcer is an open sore on the cornea of the human eye. And some signs and symptoms of this ulcer, we may visualize reddish eyes, and this is a self-explanatory sign. You just have to look at someone's eyes. If at all they are red, it might be one of the signs and symptoms that they are suffering from corneal ulcers. Another one is watery or teary eyes. Someone may start experiencing watery eyes. From nowhere, you may start viewing someone getting some watery substances on their eyes, and I think this might be one of the reasons or signs of corneal ulcers and pain. The patient of corneal ulcers may experience severe pain in the eyes because of the sores that are on the cornea. And that is my opinion basing on the corneal ulcers. I would like to know more about it from the doctor in the studio.
Okay, thank you so much. It seems that our people have nothing in as far as information is concerned regarding
The
corneal
corneal
ulcers. Why is it so?
Yes, people have perceived it differently, and sometimes they think that the corneal ulcer is the cataract. Yeah, because they see something white on the cornea, and they think could be the cataract, but people know the cataract. Yes, so there's a big knowledge gap, and because people don't know, they also come late to the hospital.
Yes.
When complications have set in.
Okay.
Yes. So it's very important that we continue this mass sensitization of the communities such that they will know. And when such symptoms, when they have such symptoms, they come to the hospital early enough. Yeah.
Like you said, people take long to come to hospitals.
Yes.
When should they come?
Yeah. So the immediate onset of the symptom, the first symptom, which could be pain, come to the hospital. Many times they try to go and look for traditional eye medicines, and the traditional eye medicines actually, which they get is plant materials, others chew them and then put in the eye. Very dangerous. You're getting more bacteria from the mouth. The leaves also have fungi and bacteria. So again, you put on the eye, which is already
You're getting the bacteria from the mouth, which contradict with the bacteria in the eye.
Exactly.
Causing another problem.
Bigger problem. So by the time they come to the hospital, they have a condition we call endophthalmitis.
And by the way, doctor, to some extent, the medicines or the local herbs that they use might be right, but even the dosage becomes a problem.
We don't know which dosage they take.
The dosage they take.
And also, they're not clean.
They are not clean.
Medicine has to be sterile, free from any germs. Any medicine that is going either on top or inside your body must be free from any germs.
Okay.
Yes, so they pluck leaves from anywhere and they put on the eyes. Those leaves have fungi, they have bacteria.
Yes.
So they're complicating even the things the more. And by the time they come to the hospital, the eye is already blind and cannot be saved.
And the situation is irreversible.
Is irreversible. Very dangerous.
Okay.
Sometimes because of the stage at which they have come, the doctors are forced to remove those eyes because the eye will now be full of pus. And that pus is dangerous.
One might see that pus early in the morning when they've woken up and think, maybe I've overslept. So what advice do you give them?
Always come to the hospital as early as possible.
First sight of the first symptom.
Run to the hospital.
Okay.
The moment you see the eye is very painful, come to the hospital. It could be a corneal ulcer. And you can be saved early.
Vision changes, come to the hospital.
Yes, vision is reducing, the eyes paining, you're fearing light, run to the hospital.
Any discharge from the eye, run to the hospital.
Run to the hospital.
Okay.
Yes.
So complicated is this disease?
Yeah, so it is indeed complicated.
Okay.
Yeah.
And how can one prevent it?
Yeah,
Any
so
preventive measures?
Yeah, so preventive measures will be now, I'll address group by group now.
Okay.
For those that do field work, where you are exposed to a lot of dust, a lot of cold wind, a lot of people who are doing a lot of field work, try to wear protective gears as much as possible. Yeah, in some of those places they provide goggles for you to wear, helmets for you to wear. So try to wear them as much as possible to protect your eyes. Number two, those who work in chemical plants, laboratories, such places which have chemicals and you have to work with chemicals, also wear protective goggles.
Okay.
Because a splash of a chemical could go to your eye and cause an ulcer.
Okay.
Number three, routine eye checkups for those with conditions or diseases that have compromised their immunity. I talked about the diabetics, I talked about those with cancers, I talked about the pregnant women, young children. Routine eye checkups are important for you.
Okay.
Yeah, such that in case of any sight of such a condition, it can be managed as early as possible. Yes.
Okay. Any more?
Yes, and important to know about corneal ulcers is that this condition can be cured actually. And if you, yeah, it can be cured. They can heal, and you can heal without any scars on the cornea. It's like a wound. Most times we know wounds heal but leave scars.
Leave scars, yes.
But a cornea can heal and leave no scars.
Seriously?
Yes, it can heal and leave no scars. But depends on how early you will come to the hospital as well, before the ulcer penetrates to other layers of the cornea.
Okay.
So if it's only on the top layer of the cornea, that ulcer can heal completely and you recover your vision very well.
Okay.
So there is a surgery that is being done lately in Uganda. It has been introduced lately, corneal transplant surgery. There are some people who are blind out there because of corneal scars. They got corneal ulcers, they healed, but they are covered with a scar. The cornea is covered with a scar.
Yes.
And the person is blind because they cannot see through the scar.
Yes, true.
There's a life-changing surgery that is ongoing. They can remove that scarred cornea and implant for you a clear cornea, a corneal transplant. And you recover sight. And we have got some testimonies of people who are already recovered sight because of corneal surgery.
Okay.
Yeah, corneal transplant surgery. Yeah, so in a few hospitals in Uganda, like I think Mengo, Agarwal and Ruharo, they have started doing the corneal transplant surgeries.
Oh.
So if you know of anyone
We are
who is blind due to corneal scars, please advise them to attend those hospitals.
Okay.
They can be saved.
This is how important this information is. Now we have hospitals here in Uganda that can help you get rid of this disease, the corneal ulcers. And for our brothers that do not have, in Africa specifically, that do not have that treatment in their countries, Uganda, we are lucky and you are highly invited.
Yeah.
Come and get the treatment. Inshallah, by Allah's grace, you'll be healed, inshallah. Doctor, let's help our brothers that have certain or other eye diseases or ailments, not like the one that we're discussing today, but the diseases that disturb them to the extent that they have to use lenses or glasses.
Yes.
How do you advise them?
Yeah, there's a common condition of eyes called refractive errors. And refractive errors can be, in a simple way, short-sightedness or long-sightedness.
Yes.
Yes. So these ones are those conditions that can be corrected only by either wearing glasses, spectacles, or putting on contact lenses, or refractive surgery, which is also being a new technology that is being done.
Okay.
Yeah, so those conditions, it is okay. And it's not age-related. Anyone can wear spectacles from a child.
What I mean, doctor, how do you help those brothers of ours to help them prevent themselves from contracting the disease?
The refractive errors.
No, not the refractive errors. Already they have. Okay. That's why they're using the glasses.
Yes.
I mean, they're already using the glasses, but how can you help them prevent themselves from contracting the corneal ulcers? Yes.
Oh, okay. Thank you very much.
Because the gears that we've been wearing, the helmets, that is for the people that have their eyes okay.
Yes.
They now, my brothers that have to use lenses as an enhancement to their sight.
That's a very good question. Reminds me, one of the causes of these corneal ulcers is wearing contact lenses. Some people wear contact lenses on top of their corneas. Yeah, so sometimes it can irritate the surface of the cornea and cause ulcers. Yeah. So, but those are treatable actually. Those are very, very treatable. Okay. Again, a routine eye checkup for such patients is very, very important. If you already have another eye disease, then routine eye check is important for you. If you have any other eye disease, please, routine eye check of your eyes is very important. Don't go 4 years without checking your eyes when you know you already have an eye disease.
Okay.
Yes. Very, very important.
Okay. Thank you so much, Doctor. Any concluding remarks before we sign out? Yes,
concluding remarks. Please, I will urge our population, especially in Africa, let us try as much as possible to be very, very to be good in seeking medical attention. Yes, yeah, because most times people come late, which is very, very bad. Let's try as much as possible. When the moment you get the first sign or symptom, run to the hospital. Okay. Don't wait after 2 weeks, 3 weeks. 3 weeks with a corneal ulcer could cause you blindness.
Oh.
Yeah. 2 weeks with a corneal ulcer could cause you blindness. So the earlier you come, the better.
Okay.
Yeah.
Our esteemed viewer, that is it for today. Unfortunately, fortunately for those that have been following us from the very beginning, you know how to protect yourself or prevent yourself from contracting this disease. Fortunately, still for those that have joined us in the evening of this program or in the late of this program, you can still visit the MTA for Africa YouTube channel. You'll find those programs prepared for you so you won't miss a bite. You still get the advice as gotten from our beloved doctor in the studios here with us today. For my brothers that do not have the chance to watch us live on the TVs, or do not have the money to acquire themselves with the satellites, because we're on satellite. We have 8 channels, by the way.
Wow.
As of now, we have
That's
8
good.
channels, different languages. You can still have the MTA International application on your phone, on your laptop like mine. I can watch MTA here, or your smart TV. You can download that application and forget the satellite thing. Today, this will be all for today.
Thank you.
And until we meet next time, I remain your host, Nambale Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.